So we know that wearing a mask protects people around you, but we're going to find out also protects ourselves as well. Both are obviously important. And I just want to comment on this because I think it is important to address this. Wearing a mask is not a sign of weakness. It is fundamentally a sign of strength. It means you care about your family, you care about your colleagues, you care about your neighbors, and you have the strength to demonstrate that. You don't look strong when you hurt other people. You just kind of look uncaring. So there's another thing about masks that I want to say right at the shot, off the starting blocks. A mask is not a sign of party affiliation. And I am so glad that Washingtonians understand that, and that all parties, all people of different political affiliations realize that the virus doesn't care if you're a Republican or an independent or a Democrat. And all Washingtonians have an opportunity here to save themselves and the people they love. We know that when people wear a mask, there's some reduction of COVID transmission. And when more people wear a mask, there's more reduction of that transmission, significantly more. Now, Washingtonians have done a great job on this. We're very, very proud of our state. We've led the state in many ways. Now we're leading the state at the moment in keeping these transmission rates low. But as the weather changes, as we go back indoors and we resume some of our indoor activities, we really have to increase our commitment to masks. We are already seeing some indications that that we've had an uptick in some of our infections. We hope that we can get that back down. So at that, I'll have more to say, and we're gonna have another important announcement later, but I'd like to defer to Dr. Schiffer for some comments, and then we'll stand for questions. Dr. Schiffer.
There are a couple of slides you wanted me to share.
You bet.
And the first is a picture of how we think masks work. And so what the panel on the left shows is, imagine you have two people and the first person is infected and the second person is not. We call this a transmission pair. The first person sheds the virus at a certain amount, and they're most likely to transmit the virus when the virus is at its highest level. Unfortunately, usually the virus peaks at its highest level before people know they are infected, before they feel symptoms. And so that's one of the reasons we've had such a difficult time containing the virus across the globe. Now, imagine one of those two people is wearing a mask, either the exposed person or the person who is a potential transmitter. What that does, and this is shown in the middle panel here, is it lowers the amount of virus that the exposed person is exposed to. And so masks are not perfect. This may not eliminate the possibility of a transmission, but it lowers the possibility. Now imagine a scenario where the transmitter and the exposed person are wearing a mask, and I'll remind you that the transmitter still doesn't know they're infected in this scenario. So both of these people think they're healthy and well. The exposure viral load goes down even more. So the benefit is accrued at a much more powerful level. So it's making an imperfect intervention better. When you average this across the population, this is where the masks become incredibly powerful. So the next slide, please. So this is something called a heat map that we love to use in mathematical modeling, and it looks complicated, but it's not so bad. So I'll walk you through this. So what each of the little squares is in the panel represents a scenario. And a bad scenario is when R is greater than 1. So that represents anything yellow or red. And good is purple or blue, meaning that our intervention has curbed the amount of spread to below 1, and then right in the middle is 1. And I would like to tell you that in the United States, most states are very much in this area of 1. And so then we track on the x-axis how well we think a mask works when it's on an exposed person and how well we think a mask works when it's on a transmitter. And we follow those two together and we come to the middle of this black square. So on the left, the panel signifies a situation which is, I think, about where we are in most places in the United States, where about 3/4 of people are wearing a mask about 3/4 of the time. And what you see is that here we're kind of blurring in from purple to orange. This is the area where we're kind of flirting with disaster. We're at this tipping point. We're on this tightrope where the reproductive number is just around 1. If you look at the panel on the right, now you have everybody who walks outside wearing a mask 100% of the time. So this is Japan. This is a very crowded country, and actually this is many countries in Africa as well that, despite limited resources, have limited the spread of the virus. And what you can see is, rather than flirting with 1, the reproductive number is in the neighborhood of anywhere from 0.4 to 0.8, and this depends on a lot of other things. But the point is just by boosting the mask use a little bit, by everybody teaming up and doing a good job, it makes everybody so much safer. And so I think really this should be our goal.